everyone, and welcome to today's podcast. I'm Lauren Hawkins, and today we're going to be talking about a topic that's really important for families. That would be childhood immunizations. We know how sometimes vaccines can sometimes feel like a big, complicated subject, and parents have lots of questions. So, to help us break it down today, I have one of our wonderful family medicine nurse practitioners with us, Stephanie Tyndall, to kind of break it down, answer questions, and teach us a little bit about vaccines and the importance behind them. To start us off, Stephanie, can you explain to us why childhood vaccines are such an important part of keeping kids safe and healthy?
Yes, vaccines actually protect the child and children for potentially life-threatening diseases that they don't have to be exposed to or have. It also protects the community and anyone that they come in contact that would be or could be potentially immunocompromised.
Okay, so question number two, what are some of the main vaccines kids typically get, and when do they normally get those vaccines?
So, when a child is born, before they even leave the hospital, we vaccinate them for hepatitis B, and they start that series then. The child will then receive a number of vaccines at 2 months and 4 months, 6 months, so forth. It goes on down. But they receive hepatitis A, hepatitis B. They also receive, starting at age 1, the varicella, the MMR, as we said, Tdap, which consists of diphtheria, pertussis, which we heard a lot 2 or 3 years ago about pertussis prior to COVID. And they can receive different vaccines for HPV, which is for cancer, meningitis. There are several vaccines available now to children. And the state actually sets forth a vaccine schedule for children, and that is set forth by the CDC. And you can actually look that up on the CDC website or immunize.org, and you can see your child's schedule, or you can ask your provider and they can provide one for you.
Absolutely. So, some parents worry about vaccine side effects. What's helpful for them to know how vaccines are tested and monitored for safety, and possible, what they might could look for as a side effect, if any at all?
So, in some of the research that I did, one of the things that I found was that vaccines for children actually born between 1994 and 2023 have prevented about 508 million illnesses and decreased it down to 32 million hospitalizations and saved 1.1 million lives. Do vaccines cause autism? That's a big thing that parents ask. No, absolutely not. There was one study that was published. The study was done on 12 children who already had some preconceived issues prior to the administration of the vaccine. And the only thing that they were able to prove is that the vaccine seemed to make some of those language barriers that they had worse. Several studies have been done since that one study, and not one has been able to prove that vaccines cause autism. I think that's probably the biggest thing that parents worry about. That's the huge one, the MMR vaccine, because it is a live vaccine and it is given, but we do not give that vaccine until after the age of 1. Now, some of the other things that parents worry about are fevers. If the child gets the flu vaccine, are they going to get the flu? If the child gets the COVID vaccine, are they going to get COVID? Absolutely not. That is also a myth. Now, if you do have a little cold and you get the flu vaccine, then sure, yes, you might could see some symptoms come out and emerge, but that's just the body's natural immune system doing what it needs to do to build those antibodies so that when you are exposed, that you can fight against them. There's also, and we were very familiar with this during COVID. The VAERS is a system that has been created. It's the Vaccine Adverse Event Reporting System. And anytime any provider or parent has a child that has an adverse reaction or an event to a vaccine, just like any medicine, it's a possibility. Then that they can report that, or it can be reported to the VAERS, and they keep a record of that. When vaccines are first created, they go through a rigorous process. It's not something that they create today and we're given tomorrow. I think that myth also came up during the COVID vaccine. The COVID vaccine itself was not anything brand new, it was in the works. What the government did with COVID is that they just sped up the process of the time it takes for the money here and this and that. The medicine was already created. They just sped up some of the processes that it takes to get the vaccine actually manufactured and out to the public. So vaccines have to go through, I think it's 4 to 5 steps of a process before they're actually deemed to be by the CDC safe and effective for the population. So they go through a lot prior to, and I don't know whether people realize it or not, but vaccines are one of the greatest public health achievements of all time. There was a time when parents would worry that if their child coughed, they were going to have whooping cough and could possibly die, spread it to the whole family, and within a week, all the family would be gone. We don't have that today. We have vaccines that can prevent these types of illnesses. Are they still out there? Yes. Are we still exposed to them? Yes. That's why vaccines are important.
Absolutely. And I think you hit the nail on the head with the myth versus the truth behind it all is, you know, asking the questions to your healthcare provider is important. And going to the internet and researching things, you don't get the full truth behind the importance of it all. And you get the misconceptions and a little bit of truth here and a little bit of truth there, but it doesn't all add up in the end. So
And that's right. I think a lot of
yeah.
people, and the internet is a great resource, but it's important that you know that you search at the right sites that you need. I think
Yes.
one thing that we do is that we kind of take off other people in our families, maybe their opinions about things, or this happened to my child. We read things online. They're not always necessarily the truth. We know that. And, if I had my vehicle was broken and I need it fixed, I certainly wouldn't bring it to me to have it fixed because I don't know how to fix it. I could look up some things, but you wouldn't want to drive it after I got done with it. So the best thing to do is to go to the expert when you have questions about certain things. And your provider, I have always had that belief that I'm not going to push anything on any parent that they don't want to do. And I respect each parent's decisions, but I also have the um, the oath that I've taken that I share with them the best possibility for their child to receive the best health that they can, and that is through vaccinations. And, if parents have time, we can sit and we can talk about those things. We can talk about the myths and discuss some of their questions about vaccines. Like I said, I think a lot of times parents go off of what they hear other people say or what they've read. There are reputable websites that you can go to. There are studies that are reputable and they can give you that answers that you need to make the best choice for your child as well.
Absolutely. So Stephanie, if a child misses a vaccine and needs to get caught up, what should the parent do, and what's the easiest way to get them back on schedule?
So first and foremost, the schedule is laid out for a purpose and a reason. You remember those statistics that I shared with you a while ago of how many lives have been saved, hospitalizations. It's important that we stick to that schedule as close as we possibly can. There's a reason that it's set up the way that it's set up. And as I said, children have amazing immune systems. And so that's why we go ahead and vaccinate them as youth, young children. And so they build that immunity to those diseases so that when they are exposed to them, they don't get them. When we miss a vaccine, we throw that child off of schedule, and potentially they can be exposed to something and then catch it. So one of the things that is important is to stay on schedule. I know some parents sometimes think, that's too many shots for my child to get. It's not. They are, like I said, little superheroes. They have amazing immune systems, and they're built to work that way. And so even if they were exposed to something and they got sick and built natural immunity, heaven forbid they were hospitalized, we don't want to do that. That's why we vaccinate. But their bodies would still create antibodies to fight against that disease if they were exposed to it again. So again, let me say the important thing is to stay on schedule. But for some reason, if a child is sick and unable to get a vaccine or out of town, or anything happens that they are thrown off of schedule, or a parent decides that they do want to start vaccinating and they have not been vaccinating their child, there is also a schedule, and it's called a catch-up schedule. And we set the child up on that so that they can catch up on their vaccines and be protected from those childhood illnesses that they're exposed to. So they can catch up on those vaccines. That's not an issue.
Okay. Are there any new or updated vaccine recommendations that parents should be on the lookout for this year?
As far as new, I think we are all aware of COVID is not a vaccine that we're actually giving pediatric patients unless they are immunocompromised this year. RSV, when we went through COVID, we saw a spike in RSV in not only children, but adults. And so, where we only once vaccinated the premature infant for RSV, a vaccine was created and put into circulation for adults and children, a series that we can give them to protect them from RSV. So there is a 2-dose vaccine for RSV that is for adults and children. So that's one of the newer vaccines that is suggested. It is not one of the required vaccines by the North Carolina Immunization Registry, but it is one that is recommended. The flu vaccine, of course, we know is a yearly vaccine. We saw a dip in the flu during COVID because everybody was at home. Nobody was exposing anybody to anything. Once we got back out and about, the kids went back to school and we all went back to work, then we saw a rise in the flu again. And so each year there is a new flu vaccine. And so, that would be one that we would want to give. The meningitis vaccines have been around for quite some time. One is required. There's one that is not required, but it will be required if they want to go to college anywhere in the state of North Carolina later in life. And so we know what meningitis can do, and if we can prevent that. And then the HPV vaccine, the younger we start, the less shots they have to get. A lot of parents feel like HPV is one of those vaccines that has to do with their child becoming sexually active earlier. Well, HPV has nothing to do with sexual activity. It has to do with preventing cancer later on in life. A bug that they can be exposed to that can turn into cancer. not just genital cancer, but it can be oral cancer. There are other cancers, and HPV is the one vaccine that we have that can prevent a cancer. And so parents need to educate themselves on that one. And so that would be one that is not mandated, but is recommended also. So as far as new vaccines, nothing really new except that we're not doing the COVID vaccine for everybody this season, but just for those who are immunocompromised or over a certain age will receive that this year. But that RSV vaccine is one that's very important to get.
Okay, so last question here, Stephanie. What would you say to a parent who feels unsure or nervous about vaccines and just wants to make the best decision for their child?
So my thing would be is that I would encourage them to become educated themselves. In our podcast, you'll find on the post there'll be a link for you to be able to get this article. Well, it's about 7 to 8 pages, but it answers so many questions in layman terms that we all can understand, and not just medical terminology, this study and that study and numbers. It just kind of lays it out simply for us to understand. But the most important thing is that you ask your provider, that you trust your provider, and talk to your provider. You can share your feelings and your opinions, and then allow the provider. They've set their opinions to the side, okay? They're not there to judge you at all, but they're there to educate you on what is best for your child. And so, first and foremost, I think would be talk to your child's provider, express your concerns, allow them to help answer some of those concerns for you. Go to this article from immunize.org that we'll have posted on this post for you to go to and open up and read some of those clear answers and smart advice about immunizations. But be educated. Don't just read something on Facebook and take it for face value. Because that not everything that we see online is true.
It's true.
And Dr. Google, he gets paid a lot, but I've never seen him tell the 100% truth. So, it's important that if you do have a question about something, that you do find a reputable source to make sure that you're making the right decision and choice. And I think for parents of children, it's natural to be a little nervous about that, especially at 2 months. They get quite a number of shots. That's where we really start the immunization process. Even though they get that hepatitis B in the hospital, those immunizations and the process of them start at the 2-month age. And so parents think that's a little baby, that's a whole lot of shots. Well, you think about the germs that little baby's exposed to, and vaccines can protect your child from those germs. They can protect them. The only disease that we've ever eradicated is smallpox. And so in the past year, I think if we have listened to anything on the news or online, we've seen that measles have become something that are back out. We saw Ebola in Africa and how big that was, and we had a scare here of it. But there are a lot of diseases that are still out there that once took families out of existence, that we now have vaccines. Again, let me say that vaccines are one of the greatest public health achievements of all time. We have here in the United States vaccines, approximately about 20, I think it is, that we can prevent these deadly diseases that once, when somebody got it, meant they would die, but not now. We see the good in those vaccines. So parents, educate yourselves. Know the decision that you're making is right because you have read reputable opinions, studies, and so forth, and read this article that will be attached to this podcast because, like I said, it breaks it down into terms that you can truly understand. Vaccines are important. Vaccinate, vaccinate, vaccinate.
100%, Stephanie. Well, I just want to thank you so much, Stephanie, for sharing your time and knowledge today. And to everyone listening, we really hope this episode answered any of your questions, our normal frequently asked questions about childhood immunizations. If you'd like to learn more or see what vaccines your child may be due for, you can always reach out to your healthcare provider or visit Kinston Community Health Center website to learn more, or give us a call and we can definitely get that vaccine scheduled to you to know what your child is due for. So thanks so much for listening, and we'll see you next time.